I'd like to do a video today and give you an example of a patient who's had an anterior posterior fusion. This is a patient who's had a fusion at the L5-S1 disc space, and this is a plate anterior and posterior. That's looking at the segment from the side, and that's what it looks like from the front. This is our patient. Let's stand over here. And you're only 3 months,
Yes.
and you were in good shape before the surgery,
Decent, yes.
and you exercise. But one of your greatest concerns was whether or not you'd be able to bend and be flexible.
Yes.
And I think most patients who've had back surgery, especially fusions, are worried about that.
Yes.
So first of all, are you having much pain?
No.
Are you better from the surgery?
Yes.
Would you mind demonstrating as an example of what somebody can do after a fusion? Why don't you turn sideways
Okay.
and just
This
bend
way?
over? Yeah, turn over and touch your toes. Now come back up. Now lean backwards. Okay, good. So one of the things I want to emphasize with this video is that a lot of motion that we think is coming from the spine is actually occurring around the ball and socket joint of the hip. So we can fuse a large segment of the spine. It does alter your biomechanics a little bit, but if you have good flexibility in the other joints, your mobility is actually no worse. And if we're able to relieve your pain, then people's flexibility and mobility actually becomes greatly enhanced. Many of the times I see patients that can't move, it's because of pain rather than actual restrictions in the musculoskeletal system. So thank you. Thank you.
Thank you.